You really will have more fun talking to each other than listening to me. So if you come sit, I'll get this over very quickly. Welcome, welcome. Also, no matter what kind of medical help you need, it's in the room today. So just know that you're in good hands. Todd, you have to go over. We're going to move people over here. Okay, welcome everyone. It is a terrific group of people. We're doing something a little unusual today, at least for us. We've never done anything like this. I think it's going to be a lot of fun, but you will decide and let us know. And part of how much fun it is depends on all of you. So most of this is meant to be highly interactive. I'm just going to quickly give you an idea of what we're doing and why you're here. So let me move through this. As you know, we're trying to ignite a patient activation movement, whatever that means, and hopefully as the day goes along, you'll get a better idea. So let me just tell you, how did we get here today? First of all, many of you know us. I'm Karen Feinstein from the Jewish Healthcare Foundation and the Pittsburgh Regional Health Initiative and Health Careers Futures, because we're kind of all one family. We have been trying to move the needle on quality and bring better outcomes, better population at a contained cost to healthcare now, well, with PRHI, engaged in this actively for 18 years, but it's always been on the foundation agenda. And we haven't been moving the needle as fast as we'd like. Many of you joined us when Lonnie Aaron came here, one of the authors of the Institute of Medicine report, Shorter Lives, Poorer Health, and you got a sense of how pervasive the U.S. health disadvantages. It is still shocking that we spend twice per capita on every one of our citizens, and we have the worst population health across almost every indicator of all affluent countries. So I know you can't read this, that's good because you'd go crazy, but it really is something that has to weigh on all of our minds. So we kind of keep thinking here, do we have the wrong paradigm for health? Is it possible that the idea that you can do anything you want during the day, during the week, during the month, you can make all kinds of decisions in your daily lives, and someone's going to fix you? Somebody went to medical school or nursing school or OT or PT school, and they're going to fix you no matter what you do. It doesn't have to do with the air you breathe or the water you drink or the exercise you have or the meals you eat or the sleep you get. None of that really matters because there's someone with a magic pill, or they went to medical school, and you're going to get fixed. We're starting to think maybe health actually happens outside the medical encounter. So we're excited about the idea of igniting a patient activation movement because in our mind, it's our last desperate attempt to do something that will move the needle, but also it seems like a darn good idea. So some of you have followed our journey. Some of you, Jack Crod, some of the others in the room are probably rolling their eyes, here we go, on a new adventure, but we started out, as some of you may remember, trying to make hospitals safer. And we put teams of people teaching lean, quality improvement techniques in hospitals. And I got to be honest with you, I don't think that's been real successful. The next thought was, let's keep people out of hospitals, right? So Susan Elster's here. She started going through all the PHC4 data, trying to figure out, how come so many people are readmitted? What can we do? Can we get money to test ways to keep people who are very complex, who have challenging health issues, to keep them out of hospitals? I'd say we were a little more successful. That worked out pretty well. One thing we've been working on is improving the capacity of primary care teams, trying to bring more social, behavioral health services into primary care, trying to think of primary care as something much more than our doctors are so stressed, a 15 or 20-minute encounter, which is really all that many of them are able to have. And then we said, aha, what if our goal was really to have patients keep themselves out of hospitals, to have patients keep themselves healthier, to have patients not needing to draw down constantly on the capacity of even the most expansive primary care team. We have something going for us, and that is there is a new consumer out there, particularly among millennials. As some of you know, the Pew study recently, I guess they're born skeptics, but I don't think they're looking to a magic fix to fix them. They're very skeptical about the healthcare system. But one thing now, consumers can go shopping. they can get all kinds of information. It's really pretty exciting, and it's only going to make transparency more real. People are going to get more information on which to choose, certainly a provider. One thing we know, this is a very recent study, 2012, and this knocked us over. Only 6% of the patients want their doctor to make the decision about their treatment and their care. 6% want it. The rest all want to be in charge. They either want a joint decision or, as you see, quite a few, over half, want to make the final decision. They are becoming more and more ready to accept responsibility. Many of you know, I don't know how many of you are wearing Fitbits, Google Watches, whatever the hell you're wearing, but people are tracking their own health on a rather regular basis, all of which I think is for the good. And so we start to think a little bit about, why does patient activation matter? Well, one thing we know, patient by patient, people actually get better outcomes for treatment. They do a better job preventing disease. There are a lot of studies. We have Alan Weil here, my friend Alan Weil, who's the editor of Health Affairs. I hope some of you saw his one of his recent editions of Health Affairs that focused on patient engagement. This is totally, Alan, out of your journal. I will not read all the data on it, but we can refer you to it if you want. But patients who are activated get better outcomes at lower cost. And this was even more interesting. Some of us traveled together to look at the health system in England and Wales. We had a wonderful time. But most interesting is what we kept hearing. Even with the National Health Service, those of us who've always said, oh, if only we had a single payer system, or if we had one organized hierarchy of command and control, we heard the same problems there that we face, but also some of the same solutions. Our final trip was to Wales, and Wales unveiled its Prudent Care, which was amazingly interesting. It's all about achieving health and well-being with the public, patients, and professionals as equal partners through co-production. So their focus, where they want to go, their new future, they're very excited about it, is involving patients, getting patients to start making decisions, making sure that the patient decides what their health ambitions are, that the patient sets their ambitions, and the patient takes responsibility for getting there. So it was cute. This was their slide, the Holy Trinity: co-production, prudence, and integration. It had a lot to do with this new partnership with the patient and the doctor, setting outcomes together, understanding that sometimes coping is as important to curing, even though you went to medical or nursing or any other school to learn how to cure, that more care is not necessarily better. We should learn that here. But everywhere we hear about bringing health and social services closer together. So that's what we heard. So we think there's a lot of value in choosing wisely in an era of data democratization. There's a lot of good data out there. And I did talk to one of the reporters who called and told her about my spinning class, where people were talking about the pain, the excruciating pain you get from leg cramps in your calf in the middle of the night, and what to do about it. And someone said, grab your toe, grab your toe. And I said, take a tablespoon of yellow mustard, all of which we got off the internet. But people are starting to take some responsibility for your health. You don't have to lie in bed every night in excruciating pain. So there's so many things we do during the day that make a huge difference in how well we are. And there's so much information out there. Our goal is to get a lot of people to not only use that information, but to speak up about areas where the health system or just the systems of any of our sectors of the economy could help them reach the health goals they've set for themselves. So today we're going from retail to wholesale. We do a lot of work. Mark is here, Mark Valenti. Mark's out there in the back getting ready. Mark Valenti has been in enormous demand by many of you and others for what he does with motivational interviewing with individuals. So we won't be able to go into that, but he does a great job, and that gets people excited about managing their own health. We're going to talk about social movements today, and that is what can happen that gets large amounts of people to change behavior, or policy changes that make dramatic differences. So we cheated a little, right? We gave you 9 examples that we picked in your playbook. If you didn't read it, we have some copies for you. But we gave you 9 examples of social movements related to health that we thought had a dramatic impact. And we love social movements, as you know. So we're going to talk today a little bit about both what makes a successful social movement, how did these things ever make the impact they have on the wholesale health of populations, and then the second half breakout, you've all been given a problem to work with, and you will come up with your own campaign. We are prepared to support you. We didn't give any group a problem that we won't help you organize, raise funds for, be successful if you can. So your work won't go in vain. We picked 6 areas. All of you have an identifier, so you know where you've been assigned. You might have realized, those of you who looked at your clippings, people looked at the clippings we sent you, that was kind of a clue as to where you're going, because the clipping we sent you is related to the problem you will be working on. Are there any questions? You have a facilitator in each group. You'll be talking among yourselves. We will come back here, and it's important that we stay on time, at 4:30, and we will hear from the breakouts. You will also get a TED Talk from Alan Weil, which is really good. You will also hear from Elliot Oshry, who many of you know has had a lot of experience with campaigns, on what he thinks makes campaigns successful, but he may cheat and circulate among your breakouts and steal ideas from you. There may be reporters who visit your group. If that's okay, they're interested in this, so just keep on with your conversation. Nancy will tell you then, after we come back, the fun ideas we have for you for exercising and dining, and then you'll go into the second breakout session. Same groups, same place. Carla, does everybody know, Nancy, does everyone know where they're going? Postpartum depression, you are going to just stay here. HPV vaccine, you are going to a breakout room in the front hall next to where the food is. We will show you right near the reception desk. BRCA 1 and 2, you are going to the large conference room right behind me. Nutrition, you are going, I thought you should have been in the kitchen, but that's okay. You're going to the small conference room 2 floors down on 24. People will direct you. Own your own health, you are going to the kitchen. Help yourself. There's some juice, food, whatever you want. And senior living, you're going to be in the large conference room on 24. Many of you have been there many times. So I think that's it. Any items I didn't cover? Any questions, concerns, comments? What? Okay, I would say now's the time. Head to your groups. If you need any help or you don't have information on something, there will be playbooks and liquid down in your groups in case you didn't read the playbook, but we know you all did. Hello. How are you?
How are you doing?
I'm so glad you could be here.
And I will be here through 7:15.
Oh, we love you. Okay.